Hello, everyone. Thank you for joining us this afternoon. My name is Juan Espinosa, Director of Student Success here at the UCLA Josie Wentz School of Nursing. We're very excited here today. We have Christina Soar with Cedars-Sinai, and she will go ahead and present on the recruitment and career opportunities available with Cedars. Go ahead and take it over, Christina.
Hello, everyone. So nice to meet you all virtually, and thank you, Juan, for setting this up. I'm really excited to talk to you guys today about the opportunities that we do have within nursing. So let me go to the next slide. My name is Christina Stewart again. I've been with the company for a little over 4 years now. I actually started out in like the non-clinical side, and then I've been doing the clinical side now for a little over 2 years. And I also run the new graduate RN program as well. So my email's right here, definitely write it down, you guys. Feel free to reach out with any questions. We will do a Q&A at the end, which I ask everybody to not be shy and to definitely ask questions. I'm definitely here to help you on your journey, whether it's just regular nursing, questions or again with the new grad program. So definitely excited to be here. Okay. Let's get started. And you guys can see my screen, right? Okay, perfect. So a little bit about Cedars-Sinai. I'm sure a lot of you are pretty aware of who we are, but we are a nonprofit academic healthcare organization. We're very, pretty known within, Los Angeles area. We have our main medical center, which has 915 licensed beds, over 2,000 physicians, and then over 4,700 nurses. We definitely, patient care is the most important thing to us. We also are a research hospital as well and teaching organization. So and professional development is super important to us with our nurses and our staff. So we have our main medical center. That's the positions that I'm going to talk about today. But we also do have a hospital in Marina del Rey. It should actually be finished here within the next few months. It's been more of like a community size hospital right now, but it'll eventually be as big as the medical center. And then, of course, we do have like our medical network as well, which is going to be more of like our ambulatory side. If outpatient nursing is something that you're interested in versus, again, what I'm talking about today is going to be more inpatient, you can always send me an email and I can kind of connect you with the outpatient side as well. But yeah, our main medical center, we have been recognized by US News World Report, many years in a row, tied for #1 hospital actually with UCLA. And, we are magnet recognized as well. So yeah, excited to talk to you a little bit about, the organization and the nursing opportunities that we do have. Okay. So with Cedars-Sinai, we do have really amazing benefits. So I'm just going to talk a little bit about what those are. So definitely a competitive salary. Some of the benefits that we include are, medical, vision. We do also offer tuition reimbursement from day one. So, if you're going to school or maybe you only have your ADN or your BSN and you want to continue your education, we do offer tuition reimbursement from day one, which is great. With nursing too, right? You have people that want to get specialty certifications and things like that. So we do give you like a $1,200 bonus for getting a specialty cert. And then of course, that's something that we can kind of reimburse you on too, like the cost for that and things like that. Once you're a part of the team, we do also have really good like referral bonuses for certain RN positions. Not every single one, but just different RN roles. And it could be up to a 10K bonus as well. And then of course we do have a really great retirement plan. It's a 403B plan. And then you also get a pension with us after a year as well, which is really great. And then we do match at 6% for the 403B, which is really great for benefits as well. Awesome. And then, so the next slide is going to be, this is actually brand new. We didn't have it before, but it's something new to our website. You can copy this website and I can also copy and paste it into the chat a little bit later. But this is going to be on our nursing or on our careers page. We have a nurse specialties page now. So what it is you can go into the nursing specialties. I don't have the pointer on here, but you guys can see it. And if you click into all of these little areas, so like ambulatory, float pool, surgical, emergency, basically there's going to be a video of every executive director talking just a little bit about those areas and what makes those areas great, right? And what they're focusing on. So I think it's really good if you're not really sure, right? Especially as a new grad, you might not be sure where you want to go or what where you want to actually, I guess, be, right? So if you go into there, you can kind of click and hear from our executive directors directly, and they'll kind of talk about each area and what those are about. I think it's really cool. And then it also has David Marsh on there. He's our senior VP of chief nursing as well. So he makes a little clip on there and talks about patient care and why it's important and things like that. So yeah. And next slide. So again, professional development is really, really huge with Cedars-Sinai. So with us, if you come into our new grad program, which I'm going to talk about in the next few slides, we usually have at least 3 cohorts per year. You do have to be accepted into the program, but if you are accepted and you do get an offer, you'll start as a clinical nurse 1. And then once you graduate in that first year, then you will change to a clinical nurse 2. And, you know, we do, again, have that ladder. So after the 2, there's the 3 and then the 4. So usually the 2 is just really gaining experience, right? Those patient care skills and things like that. And then usually once you have a specialty certification with us, and then you've been a nurse for at least 2 years in an acute care setting, you can qualify for a 3. Of course, with the 3, you know, you start maybe precepting or doing education, right? Also, there's going to be a lot of opportunities on the unit, right? Like projects and things like that. That's what they would like you to do to start getting towards that 3. And then the 4 is, again, maybe being a part of hiring, precepting, things like that. So we do have a really great clinical ladder program as well. And it's definitely encouraged for you to work towards, you know, the specialty cert. And if you don't come in through the new grad program, we do, again, have, you know, you can come in with a CN2 with us. It would be 1 year of acute care RN experience. So sometimes it's really tough to get into the new grad program, right? It's really competitive. So if you don't get in with us as a new grad, you can always apply as an experienced nurse at a level 2. And all these positions, you do just need to have, or I'm sorry, for the 1 and 2, it's at least an ADN as well, okay? And above. Sorry, a little thing came up on my screen here. Okay, perfect. So let me talk a little bit about the new grad program. So our upcoming residency date, first and foremost, we are going to have a cohort opening up here on June 15th. And then the start date of the program is going to be August 24th. So that's going to be our next one. Right now, we don't have the 2027 dates yet finalized. We should have those finalized by the end of June. I'm just confirming rooms and stuff like that. But there are going to be at least 3 in 2027. I can tell you that the next one after this one will probably be like opening in October, November, because they like to do interviews and stuff like that before the holidays. And then usually the start date is sometime in January. So just so you guys have a timeline if you're not hired into this one. But the requirements to qualify for a new grad residency program, you do have to have a California nursing license at the time of the application. I get the second question, or I get that first question a lot, right? So you need to have your education, which is at least an ADN or above, and then the license at the time of the application. So I get that question a lot where, oh, can I just apply and then before the interview, like, you know, get in? No, you have to have it at the time of the application. And then you do have to have at least less than 9 months paid RN experience on the date of the application, and then at least a 3.0 GPA or above. And you must have not graduated more than 12 months of the application date. So if the application date is June 15th, you can have it graduated, you know, a year before that. And then you do need to have at least a BLS or an ACLS. I would say at least the BLS is fine, guys. I get that question a lot too. Like, do I need to get PALS? Do I need to get ACLS? Like, should I have those things? If you can get those, that looks better. But some of the units too, they may not require that. But typically what'll happen is if you get selected to interview, I'll do like a connectivity test a week before, and I'll go over like, you know, what certifications you need and things like that. But I would say at least have the BLS with your application. Perfect. And these are going to be some of just like the guidelines, including like pay, and then I'll kind of talk a little bit about what the program entails, okay? So this position, it is a full-time benefited non-union employment opportunity. So we are non-union, so you don't pay union dues with us. All the positions are going to be 3 12-hour shifts. Primarily, they typically hire for night shifts. Sometimes it could be days, right? So I would say being open to both is great. Day shift hours are going to be from 7 a.m. to 7:30 p.m. and the night shift is from 7 p.m. to 7:30 a.m. And then pay is going to be completely based off of your education. So if you have your ADN, it's going to be $48.50 an hour. BSN, it is $50 an hour. And then your MSN, it's $51.50 an hour. And then for the shift, they do give a shift differential, which is great for the new grad program. So it's going to be $5 an hour on Saturdays and Sundays if you're doing day shift. And then for night shift, it's $7 an hour Monday through Thursday nights. And then Friday, Saturday, and Sunday weekend nights, it's $9 an hour extra on top of that base rate. Okay. And then after you graduate from the program, typically your rate will go up, right? Once you graduate from the program. But the program timeframe, it's 1 year program consisting of 8 to 12 weeks precepted clinical orientation, and then you have 13 plus didactic/interactive workshops. You will work the same shift as your preceptor. So if you do apply and you get an offer with us, whatever the offer or whatever the shift is on your offer letter, that would be what shift your permanent shift is. But again, sometimes preceptors only work in the days, right? So if you get a night shift position, you may have to do days the first, couple weeks or whatever that may be, just for that precepted clinical orientation. Okay. And then post preceptive shifts, again, you'll be placed on your permanent assignment. With us as well, the workshops will be throughout the year. So it's a combination of the didactic learning, hands-on skills training, simulated experience, group/work projects, support rounds, and group discussion. And then makings of a successful new grad with us here at Cedars, it's really attending all the workshops. You will do a completion of an evidence-driven project and then receiving at least a meets expectation on your performance eval. We do, of course, have like a strongly meets and exceeds, so that's even better. But that's just kind of what they would expect of you, within that first year. Awesome. And then I wanted to kind of touch on just some like application process and then resume tips, right? So this is going to be our career site. I will post it into the chat here. Let me see here. I'll post it into the chat, and then I'll also, guys, just put like my email there. So you guys have it, since I know it might be hard to copy on the slide. Or from the slide, I'm sorry. One moment. And then again, any questions, you guys can always send me an email, happy to help or connect you with like the right person as well. And then our new grad site as well, there's a ton of information on there. That's just gonna have there's also like an FAQ page on there, right, too. So if you guys have any questions about the program or what your application should be like, I definitely recommend checking that out as well. But I do recommend, once you get to our website, to kind of create a profile. You can sign up for job alerts, look at current openings and things like that as well. The new grad residency program, it will title of title of the job. It should say new grad residency program, and then it should say summer 2026 for this next one. So you could just type that into the career site and it should populate that way. But definitely recommend, customizing your application to the job that you're applying for. So with our new grad program specifically, it's going to ask you questions on the application. So it's going to say, it's going to make sure you meet all the qualifications by asking all those questions, but it's going to ask you what's your first unit choice and what's your second unit choice. So, and there'll be a question on there too, if you're not selected for either choices, are you open to another unit, right? So That's why I recommend looking at that nurse specialties page. So that way you can kind of figure out, okay, well, I think this specialty sounds good, or this one. So you can kind of know what choices you want when you before you go into the application. And again, customizing your documents. So the documents that are required, I'm so sorry, I forgot to put it on here, but I know. So you need a personal statement. You also need a cover letter, two letters of recommendations, and then a resume, of course. With your resume, you can like upload, or you can put on there like your certifications, your education, all that good stuff. And then you also need a transcript that actually says graduated. If it doesn't say graduated, or we can't like see that it's completed, you won't be considered. So make sure that it shows your graduated date and everything like that. And so those are the documents that you need. You can also upload, any other certifications or multiple letters of recommendation as well. But yeah, again, customize your application to the job you're applying for. Make sure your resume is straightforward and easy to read. And making sure grammar and all that is good. And then your contact information is up to date as well. Okay. Let's see here. And then I want to make sure I went through everything about the program with you guys. Okay, another question that I get a lot too is with the new grad program, like the actual interview. What are they going to ask me, right? What I highly suggest for that is to try to do a mock interview with another nurse, right? Like ask them, hey, what did they ask you on your interview, right? Try to do like a mock or like a role play type interview. Definitely want to 100% come with questions for them. And then you definitely want to come with like, why do you want to work in this unit? And what do you know about Cedars, right? Like what makes you stand out with that? So you definitely want to know that. But a lot of the questions are more like, personality, or they may ask you some like clinical questions as well, right? Like based on your rotations and things like that. So yeah, just kind of be prepared for that as well. And then as far as the pay rate and things like that, I do want to let you know, like we don't negotiate on that. That's just going to be kind of standard, rate of pay for the education. And again, it's just based off of education. And then next slide is just going to be for Q&A. I know we kind of went through a lot very quickly, but definitely happy to answer questions. But this is just going to be a scan. If you want to scan, it'll take you to our career page as well. But yeah, I'm happy to answer any questions that you guys might have. I know there's a lot of people on the call.
Thank you, Christina. That was great. We're gonna go ahead and open it up for Q&A. So if you have any questions, please feel free to unmute yourselves or drop your questions in the chat. So we're gonna get started with Q&A.
Perfect.
Any questions?
And please don't be shy. Definitely, again, here to answer any questions that you guys have. I'm going to go back to the new grad slide just so you guys can kind of see it. And yeah, go ahead. And if you're shy to answer a question, or if you're too shy to speak up, feel free. You drop the question in the chat if you want. Okay, I want everybody to feel comfortable. Is there a hand raise on this one or no?
Yes.
Oh, can you go back to the slide with your email?
I was trying to find the hand raise, but I do have a question actually. Thank you so much, Christina, for the program details. I wrote down a few questions. So in terms of our timeline, we graduate in June, and then we need like the ATT number to take the NCLEX. So I wanted to just verify that like that timeline works for the program, because you said we had to be licensed by.
Yeah, so you have to be licensed by the time of the application date. So if you guys graduate in June, you're probably not going to have it until like July, right? So unfortunately, you will have to wait until the next cohort. I don't have it finalized yet. This is a tentative date. I'm happy to share it, but again, I don't know 100% know. If you guys email me, I can send you the dates when I get them, right? But the tentative date, it's like opening November 9th with a start date in January. So it's definitely going to be at the end of the year, the next one.
Okay, so even though we'll like have our license by the like start date of the program, because we don't have it by the app, doesn't count. Okay.
Yeah. Unfortunately,
Gotcha,
that's what it
gotcha.
would be. And the reason that is because we get like 900 applicants in 3 days. So the
So,
application is only usually open for 3 days. Like I post it at 8 a.m. on Monday, and then it's taken down like Wednesday evening just because it's due to applications. So, and it's hard for me because we don't use like AI or anything, right? Like I go through every single document. So it's hard. It's just hard to it would just be hard to track everybody down, like, oh, when are you taking your boards, you know? So that's why we kind of made that rule.
yes, that makes sense. Okay. And then, yeah, that was my second question. Like, how long does the app stay open? Is it a hard close at 3 or does it 3 days later, or does it close
It's
like
definitely 3 days. Like I usually take it down by 6 on Wednesday.
number? Okay.
Hmm.
Gotcha.
Yeah.
Gotcha.
So I recommend getting your application in within the first 24 hours. Like that's what I would suggest
That makes
if
sense.
able. Hmm.
Okay. And then my final question is for in regards to the transcripts, um, do we have to like order official transcripts to get it to say like that we graduated, or can we just like download the transcripts and
It
send
could be official or unofficial as long as it just says graduate on it or graduate or like a conferred date, right? Those type of things. Yeah.
Gotcha. Okay, thank you.
Yeah. Thank you. Thanks for asking question.
We have a couple of questions in the chat.
Hmm.
Let's see. One of them says, "What is the application date for the next cohort after this summer? A lot of us won't be able to take the NCLEX." That was Olivia's question. Until July, so we won't be able to apply until then.
Yeah, so I kind of touched on that. That was again, it'll probably be towards the end of the year. So again, tentative date right now is November. I won't know till the end of June if that is 100% because it could change, but it's probably going to be end of October, beginning of November. So again, if you send me an email, I can kind of like send you guys that information when I get it. But it would probably be at the end of June when I get the final date. Okay. And then I know
Sorry.
Mamoka said, thank you for organizing this. Leaders, what would you say makes a candidate stand out over others? I would say I definitely read the personal statements, right? Like make your personal statement kind of stand out to your first choice. Um, and making sure application's complete and getting it in quickly, right? That's what I would say. And that's kind of what I would say. And just remember too, like it is super competitive, right? And sometimes it's hard to get in your first time, but don't give up, right? And I'm sure you're also applying to other schools or other hospitals as well, right? So just don't feel discouraged if you don't get in the first time, because I've had people where maybe they don't get in the first time or the second and they get in the third, right? So just know what's meant for you is going to be for you, okay? And just keep that positive attitude, because I've seen it a lot with students where they get discouraged and it's like, I feel like, again, what's meant for you is going to be for you and it'll be the right opportunity.
That's great advice. I see Rose has their hand up.
Hi, Rose.
Hi, Christina. Thank you so much for this presentation. Two questions. One, do you suggest kind of applying for prior roles or like other positions within Cedars first in order to kind of get that kind of the whole idea of like getting that foot into the hospital? Would that increase our chances of getting into the new grad program?
So it's because right now, especially with your guys' class, it's very tight, right? So typically with us, let's say like I've had somebody this week where she tried to apply for like a CNA position, but with our internal positions, you have to be in your role for 6 months. But it doesn't really make sense for a manager to onboard you right now, right? If they're going to lose you, like, oh, you're just going to apply the program and you have to wait 6 months. So if you want to wait 6 months, you can, but it doesn't necessarily also gain a spot, right? So I would say just continue applying and things like that, because again, with us, it's a minimum of 6 months before you can actually transfer.
Okay, got it.
So I would say it might not be the best if I'm being completely transparent.
No worries. I'm not applying this year.
No, that's okay.
Yeah.
No, and some they'll go work at home health, right? They'll go work in home health or they'll do long-term care for a couple months. And that's why we give you at least as long as you have 9 months paid, 9 months less paid, right? So I see that on applications where somebody goes, works there, gets a little experience, and then they apply. And then it's nice because you have a little nursing experience, right? Even though it's a different setting.
Cool. Okay, awesome. And then I'm personally interested in doing like research, nursing research and being involved in that. does the new grad program kind of have a space that allows us to kind of tip our toes in there or opportunities to kind of shadow nurses that way?
I think within the first year, it's going to be very big on just learning, right? Like your nursing skills and things like that. That's actually a great question. I've never really been asked that before. Um, I would say no, though, right? Because I know, like, for example, though, like we are a research hospital, right? So, like, I know, like, for South Oncology, they're super big on like research and stuff like that. So, like, I know they may have like opportunities, I don't know, maybe like projects and things like that. But I would say, especially in that first year, you're probably going to be more like learning how to be a nurse, learning the skills, making patients comfortable and things like that before you can kind of dive into the research side.
And then but after the kind of the program, I guess, um, is it pretty fluid in terms of getting into the research side, or would it also be considered like a transfer almost?
Oh, that's definitely a transfer. Yeah. Like you would have to apply and go through the process and things like that. I would say like I'm not super I know research nursing is so different from what I recruit for and I'm not super educated on it to be honest. If you like, you can email me and I can probably connect you with a research nurse who might be able to give you some more information. Because they probably have like different qualifications and things like that too, right? So I'm happy again if you want to email me, Rose, I can kind of connect you with a nurse who can maybe give you a little bit better info on that side of things.
Got it. Thank you so much.
Yeah, of course.
Hi.
Jenna?
Yes. I had a question regarding unit preferences because personally I'm interested in either pediatrics or NICU. How likely would it be that you guys hire in those units for new grads?
It's very, they don't always participate, to be fully transparent. So sometimes with like those, it's usually only like 2, 3 spots, right? Or 4 spots. What I would recommend, Jenna, is if you get my email and then maybe you reach out to me before that next cohort, like usually I'll know what units are participating about 2 weeks before the date. So you could always email
Okay.
me.
Okay.
If they're participating, I'm happy to let you know. Like, yeah, they're participating or they're not, right? So that way you know. But
Okay.
they don't always. And same with ICU, because we have an ICU internship as well. So sometimes like ICU and then those women's and children's, they don't always participate.
Okay. Thank you.
Mm-hmm.
I see more
Awesome. I
questions
think
in
we
the
have a couple.
chat.
Yeah.
Yeah.
So
This one, yeah,
Serena,
go
you
for it.
said, do you have any recommendations for applying for a clinical nurse 2 role for those with nursing experience? Serena, do you have acute care? Like, is it in a hospital? Is it at least 1 year? Or is it like long-term care or acute care? Or
Hi,
like,
Christina. I have acute care experience. I've done med surg as well as tele and step down. Um,
yeah.
and
Well,
I've been
you're
like
talking to the right
applying.
person.
Yes. I've been
Yeah, I'm
applying
actually
on
the
the job
recruiter.
centers. Yes.
Yeah, I'm the recruiter for those roles. So if you send me your resume, I can, reach out to you. I'm actually going on vacation on Friday, so I can call you like today or tomorrow and I could tell you what opportunities we have. But yeah, for those, as long as you have 1 year in a hospital, we have different specialties, right, that you qualify for. And then we can kind of talk about that. But yeah, you would definitely qualify. Yeah, as long as you have the 1 year.
Okay, great. Thank you so much. I'll send you an email.
Okay, perfect. And Andrea, how long should the personal statement be? If you go to the FAQ page on the new guide program, it kind of has those questions on there as well. But as they don't want it more than 2 pages. And I think it goes a little bit more in depth on what you should have on that. But I know it's definitely not longer than 2 pages. And then you said, for those who are a part of the Aspire program, how does the transcript saying graduated work, saying, I'm not sure how fast our transcripts will be updated. I would say that's going to be a Jester question. If you're part of the Aspire program, he'll go over all of that with you. I would say ask him that. Okay. And then Julie said, are you just recruiting for BSN or are you also recruiting for nurse practitioner roles as well? I'm a little confused by your, are we just recruiting for BSN? No. So you have, for any of our nursing roles, like our CN2 positions and new grad, you have to have an ADN and above. And then I don't recruit for nurse practitioner roles, but I can definitely connect you with the recruiter for those positions. We do have them. I can, again, if you send me an email, I could connect you with that recruiter too. That's okay. Thanks for your question. Awesome. Any other questions? I think I went through all the questions in the chat here. I'll go back to the new grad slide.
Any other questions?
I guess one thing I can talk about is maybe like the nurse specialties, because I know I get questions on that. So, you know, we have different specialties, right? I'll talk about the ones in the new grad program specifically. So we have like med surg, right, or medical surgical units. We have like we have cardiac units, which is like a 5 north or a 5 north cardiac tele, or a 6 south advanced heart failure. So those are going to be cardiac units that usually participate. They're still at like a PCU level though, right? So those are good units if you do ever want to go to ICU. It is recommended with the new grad program that you stay in the program for 2 years before transferring to ICU. Because again, we do have an ICU internship and we do have an emergency department internship as well. So again, it is kind of like a guideline that you stay within the new grad program for 2 years and then you apply, then you can kind of venture out to those internships. But you'll definitely talk about, you know, you would definitely want to to your manager, right? Like, hey, I'm interested in ICU and things like that. Don't be afraid to shy away from that, like in the interview and things like that. Another thing, emergency department, they don't participate in the new grad program, okay? They only do the internship. Just so you're kind of aware with that. And then, again, we have women's and children's areas, and then we also have like ICU, and then we also have operating room and PACU. So they sometimes hire new grads as well. Not as often, but the most areas that hire are going to be the medical and then surgical areas, okay? So again, that includes like oncology. We have like an alternate care unit, a short stay unit, like a surgical neurology spine, a surgical, like a 4 north neuro and stroke. So those are all just kind of units that typically participate in the new grad program, okay? We also have a float pool as well. And then like I'm sorry, I'm having a brain fart. We have another unit, which is like a surgical step down liver transplant or a surgical step down cardiac too. So those are the ones that typically usually participate. And then Daniela, is there a way to get a language certification, specifically Janet? Is there a bonus for it? We don't typically give you a bonus for that. The only bonus we usually give you is like a specialty cert, right? Like a medical surgical certified nurse cert or a critical care certified nurse cert as well. Just some examples. Awesome. So any other questions, you guys?
Any more questions? Can you talk a little bit about the hiring process?
Yeah, the new grads or just in general nurses?
The new grad.
Okay. Yeah, so with our new grads, a little bit of the hiring process is, so you would apply to the program, and then typically, again, I'll take the posting down about 72 hours after. And then typically then it's kind of where I start beginning like reviewing applications and things like that, right? So again, making sure you have a complete application and that you applied within the first, as soon as possible is always better, right? And then typically from there, what happens is I will select candidates from there, like who's chosen, again, depending on like first and second choice, and then how many interview slots I'm given from the managers and how many they're hiring, right? And then from there, typically you will be notified within 2 weeks if you were selected. So you'll either get like a rejection email saying like, unfortunately you weren't selected, or you'll get an email from myself saying like you've been selected to interview. So a little bit about the interview process and that selection goes is some managers actually do virtual interviews and some do in person. So for the virtual, I'll typically send you an email like, hey, you've been selected, and then you'll get like usually a virtual invite right after, right? But if it's in person, the department admins, because I actually sit in Arizona, so I'm not there to walk you guys in and things like that. But for the in person, typically I'll send the admins who's selected, and then the department admin will reach out to you to get that scheduled. The interviews are usually about like a month. Like you'll have a month to prepare, right? Like it's usually about a month out from like when you're selected. And then again, what I'll do is a week before the interview process, before the interviews, I'll do a kind of like a meeting like this, a connectivity test where I go over the program, answer any questions, prepare you for the interviews and things like that. And then of course you'll do the interview. And then typically once you do the interview, you'll be notified by that following Monday if you got the offer or not. So usually the interviews are going to be on like a Wednesday, Thursday, and then I usually work on offers right away as I get them, the feedback, and you'll be notified by Monday if you got an offer or not. And then of course you'll have onboarding after that. So that's like background drug test, employee health, they'll go gather your certifications, your nursing license, and stuff like that as well. But that's kind of a little bit about the timeline. From the application point until, you get an offer.
Oh, Rose.
Hi again. Okay, follow-up question. So I know you said that you're looking at the apps and then afterwards you check the availabilities with the manager. So is it more so y'all are matching the applicants to the units, or you kind of like look through all the apps and then you pick out like the individuals that you're like, we like these people, and then kind of distribute them appropriately throughout the
Yeah,
unit?
so it's depending on the interview slots that I'm given, right? And I go by earliest application to newest. So that's why I say apply within the first 24 hours, right? So that's why it's like that. But I don't go through it's hard. I can't go through 900, right? On my own. So that's why I recommend getting your application in like as soon as possible. Yeah. Yeah, thank you for your question. I'm just making sure we went through every question in here. I think we did. Okay, Melody, you said, I still have a couple years before I need to apply for an RN position, but I'm interested in the CNA. Is there any other tips you can give me for that route? Yeah, so I actually recruit for CNA positions for my areas. So, if you have a time, I think it's a good to get in as a CNA, right? If you are going to school, because that again, it's once you're in, right? And then let's say you work in the unit that you want to be a nurse in, like you already built that relationship with the manager and you already know how the unit works, right? So, yeah, I can again, if you want to. So we do call our CNAs at Cedars Clinical Partners. So you could go to our website. Well, this is what I would recommend. Go to our website. Type in clinical partner. It'll say on their days or nights. So if you want days or nights, and then you could apply to a bunch. And then if you want, you could just send me an email like, hey, Christina, I applied to a bunch of clinical partner positions. and then I can connect with you, and then we could kind of see what and get you set up for that process. And typically our regular interview process, like with that, Melody, just to touch on it, is typically you do an interview with myself. I'll go over the pay, all that stuff, right? Qualifications, make sure everything is good. And then after that, you do an interview with the team. And then typically after that, we do references. If those come back good, then they make an offer. So it can be kind of a quick turnaround. But I would recommend definitely, again, if you can get in as a clinical partner, a transporter, like any type of clinical role, just to kind of get your foot in the door that way, it's always good.
Can you talk a little bit about what can our new grads do to stand out in the process?
Yeah, so I kind of touched on that. I just kind of said, tailoring your application to the unit that you're applying for, right? So like your two top choices. The managers, one thing that I forgot to mention this, is I actually do send them every document that you apply. So every document, like the personal statement, your transcripts, the resume, all that stuff, I send it to the managers like a packet before the interviews. So it always looks good when, you're kind of standing out with your personal statement. They really, really like reading those. So I would say having a really great personal statement makes the application kind of stand out.
Any other questions? Don't be shy.
Yeah, don't be shy, guys. I'm trying to make sure. I'm pretty sure I went through everything here.
How many new grads does the RN program usually take, like in total? Do you have like an idea of how many get chosen?
Yeah, it's usually a minimum. They're definitely smaller, right? Like during COVID, they used to be a lot bigger. Usually they're like between 30 and 50 is the number that they hire for. Yeah.
Okay, thank you.
Yeah, of course. Any other questions? You can also drop them in the chat too.
If there are no more questions, we're gonna go ahead and close out.
Perfect. Well,
Thank
thank you all so much for being here, and thank you, Juan, for organizing this. Really excited to see some of your applications in there. Again, guys, feel free to email me if you have any questions or need any guidance. Okay, I'm always happy to help. It was so nice meeting you all.
Thank you, Christina.
Thank you.
Have a good day. Thank you. Thank you,
Bye.
everyone. Bye-bye.